All right. Oh gosh, I finally got it to work. There we go. There we go. Many technical difficulties today. Thank you everybody for being on. This is Dr. Phil. I still can't figure out why I got multiple screens like that today, but we'll see if we can get it ironed out here in just a second. There we go. We got Christopher on with us. How's everybody doing today? Thanks for your patience while I had some technical difficulties. Just wanted to get the show kicked off here and get everything going as far as the live broadcast goes. I should be able to, we'll have some announcements at the end, but why don't we just go ahead and get started? Christopher, why don't you tell us a little bit about who you are and kind of what's going on?
Yeah, so my name is Christopher Schlenger. I'm actually a chiropractor by trade. So I started Verdure Imaging quite some number of years ago, and the mission and the goal was to find a way to see the spine without having to do radiation. And so that led us down the path to ultrasound. So we created the first 3D spine ultrasound system in the world, and so we're proud to release it to the chiropractic market first, actually. So that's our number one goal, is get it in the hands of the practitioners out there.
Well, thank you so much for being on with us today. Christopher and I didn't meet him initially at ChiroFest, but he had a booth at ChiroFest, and I was like, man, this is some cool technology. I got to get this out and show some more people this technology and that kind of thing. I met some of your staff. Is that some of your staff members, or were those just?
Yep.
Okay.
Some of the sales team, yep.
Yeah, and so then I set up a demo with him to kind of see how the technology works, and even more so was blown away by the technology. I think, can you tell us a little bit about your story? Because I know you and I talked a little bit when we had our call about your story, because I thought that was pretty cool how you got into this and that sort of thing.
Sure, yeah. So it really began about, my daughter now is 15. So began when I saw her face on 3D in the ultrasound in utero. And so I was blown away at the quality and how accurate that face reconstruction was. And so
amazing, huh?
Yeah, it's amazing. So I was blown away. So I thought, well, it seems to me like if we can do that, maybe we could see the surface of the spine in the same way, right? If we can see the surface of the face, it led me to think maybe that's possible. And so, so then I went ahead and started looking and doing some research and finding out that, well, it's definitely possible, but very challenging, very, very difficult to do. And that's really because ultrasound inherently likes to come, if you're going to image it, you have to see the thing that it's reflecting back. And so unfortunately, the sound wave essentially bounces away off of the bone, away from the probe, so you don't get anything back really. So there's a lot of problems with building an algorithm. So that led us down the road to AI. But really the reason why I wanted to do it was I started, after practicing for a number of years, I started realizing that a lot of the stuff we're working on as chiropractors probably started in childhood. And so it got me thinking, how can we really take the profession from really working on people in their 30s, 40s, and 50s and really start thinking about how can we start seeing them a little bit earlier, a little bit younger, fixing those problems at an early age and spotting them. I can't count the number of cases of scoliosis that I've seen in 40-year-olds that are 15 degrees, 25 degrees, never diagnosed, never knew about it. Now they're having all these issues. And so I thought, sheesh, if we had not only a good screening tool, but what if something was as accurate as an X-ray that we could produce and maybe change the profession, maybe change it from something that we wait until they're hurting. Maybe we start working on things like they do with teeth, early, 12-year-old, 13-year-old, 14-year-old kids.
So give everybody a little bit of a breakdown on how 3D ultrasound works and how you help patients. Are you going to do any type of, do you want to share anything on the screen?
Sure. Yeah.
I'd love to have everybody see kind of what you're doing.
Yeah. Let's show you. I'll share this here. So what we do is we take a 2D ultrasound. So we're able to get it's a company called Clarius. So we actually partnered with they make a mobile or portable pocket ultrasound, and we're able to take that, integrate it into our Windows platform, and I'll just hit play. And so essentially what we do is we track where the probe is on the patient. And so what that allows us to do is when we're taking a scan, it allows to track the individual slices through space. And so normally if you just take an ultrasound, you're only going to see 2D, right? So you need to make it 3 dimensions. And so with our system, what we're doing is tracking it with, sub-millimeter precision. And then I'll just pause it here. The part that's probably the most challenging is to show the algorithm what is bone in this image. So if you just look at this image, if anybody's looking at this right now, you might go, where's the bone? And so what we've had to do is we've had to train AI to see in this kind of messy image here, which structures are bone and which structures are not. And so what we do is we spare just the bone, and we're throwing away pretty much everything else for imaging purposes. Then you'll see on the right here, this is the reconstruction that we make from what we see in here and from the tracking. And so this little black box here that's moving around, that's what the 2D ultrasound is seeing of over here on the left-hand side. And so if we just continue along, I'll just fast forward it. So we're able to get a accurate surface reconstruction. So it's actually seeing the surface of the spine. And so I'll jump over to our actual software. And this is an individual case that we have to look at. It's a female, by the way, again, a young female, I think 15, 16 years old. And I'm going to hide our little landmarks that we are currently doing manually. So the landmarks are placed just like you would in a regular X-ray software, but of course in 3 dimensions. But what you can see on this particular patient, I think quite clearly, is you can see, of course, the lumbars down here. This is the rib 12, rib 11 as it goes up. And you can see she clearly has a curvature here. You can even see the ribs are a little bit flatter on this side, a little more of a peak on this side. As you know, when you have scoliosis, you're going to get one set of ribs popping up and one set of ribs flattening out. And then, of course, from there, we get measurements. So we can get different measurements with our system. And so we can get flexion extension view measurements. We can get, my favorite is the axial rotation, something that you just really can't appreciate on an X-ray. So you can actually see the spine is twisting all the way up into the spine from the thoracic to the cervical. But again, this is like what I would say a traditional Cobb angle measurement. So we're using the transverse process on this one, but we get essentially the same numbers that you would get using a transverse process as you get on a vertebral end plate. So.
And I think, do you have any images you could show everybody about what it looks like externally when you're actually doing the ultrasound on the patient?
Yeah, so we, let me grab a video.
Because that was when you and I were talking, that was the thing I was having the hardest time wrapping my head around was, how are you capturing this? Like, how is it practically being done in the office, and it seems as though you have it set up that it really is, it's very practical, right? Very easy. Allows for it to be done in the office without the need for X-ray or unnecessary radiation.
Yeah, so this is just a short little video. So you can't really see it, but up top here we have the camera system. You can't. It's so small that you really it's not that difficult to mount. It's super light. So the patient, of course, is lying on their stomach on this setup. We can do people ask standing. It is possible. All the research we did, by the way, was standing for this project. But for most installations, it's just easier to scan the spine when they're prone. But Yeah, and I'll just hit play, and so you can kind of see that you have a little marker that the patient wears, and then you have all your settings on the left here, and then of course that's your 2D scan, and then basically what you're seeing is the same one I just showed you. So the same patient, same reconstruction. Yep, there's a little bit lighter. I'll pause it for a second here. I'll go back. You can see the camera briefly here up top. Nope. Right there. There we go. So the little camera's up top on the ceiling.
Oh, okay.
Yeah.
That's what's projecting it. Yeah.
Yeah, that's what's there's these little markers right here on the probe. Those little white little balls, if you will. Those are they're little points of light essentially. And so it's the same thing as you've ever seen those people do those movies where they wear those little dots all over. It's the same technology, actually the same company that makes most of the film stuff. So it's through a company called Omnitrack. So we do use their system. And and there's the 2D scan, and of course all your settings on the left. In the middle is the 2D, and then on the right here, 3D reconstruction.
What I think is cool to kind of point out is how you had your assistant, right, basically using the ultrasound wand, right?
Yes.
And it was very similar, like an ultrasound wand that you would use in gynecology setting or anything like that, right?
Same. Yeah, same.
And does that particular assistant that you had using it have any particular training other than what you've given them, or?
No, the nice thing about our system is they don't really need to have extra ultrasound training. So the AI really does a lot of the work. Now, you can improve the quality of the scan if you do a good job adjusting those settings. So one of the things we like to do is train whoever's going to be the main person, so they know how to get a good scan. But basically, the AI is doing all the work. So even if you do it poorly, you'll still get a good quality image. But obviously, you want to do better. And then one thing I was just going to show you here. This is just we just got this today. Well, a couple days ago, really, but today it's installed. But this is our holographic display. I don't know if you can see that, but we basically take the output of the spine and turn it into a holograph, and then from there we actually have a spine model. So it looks a little blurry. Hang in there. We got a few more settings we're going to make some adjustments to, but it's basically the output goes to a hologram, so you can see 3D without glasses.
Well, I got a few more questions for you, but we have some comments in the chat or some questions. I got some comments too saying this is amazing. So if people want to get more information, where do they go? Because I know Tiffany's got some QR codes that people can scan as well. So can you tell us the site and the way to get more info?
Yeah, so www.verdureimaging.com. So VERDURE imaging.com for more information there. Excellent. In addition to that, we do have a page on LinkedIn. We try to keep updated regularly. So if you're on LinkedIn, jump on LinkedIn and look us up for Verdure Imaging. And we have quite a few videos and things that we like to show people how to use the system and things like that on there. So
we had a question about, is this static or dynamic imaging?
Well, it's essentially static, right? So we'd like to make it 4D at some point, which is movable while you're doing stuff, but it is static. So it'd be the same as doing an X-ray. So as you're scanning, you're taking you're essentially taking the slices of the patient as they're in that position. So
I wanted to, can we touch a little bit too on how you help patients, how you use this in a patient setting to help them understand their progress, how it helps you with retention, compliance, all of that kind of stuff. Can you talk to that a little bit?
Yeah, definitely. So we use it in a couple ways. One is that we use it as a good screening tool for kids, pregnancy, things like that. It's normally where you would maybe rule out taking an X-ray, but the parent really wants to know, hey, is my kid's spine lined up? So it's one of the things you don't have to think about X-ray as a barrier. You just say, yeah, sure, yeah, we can do that. But for regular patients coming in, we're chiropractors obviously work on all joints, but spine is our main one that people come to us for, neck and low back. And so when they come in, we do just like you would with an X-ray. We do a scan of the patient, and we have them come back, and we do an official report of findings with the report. Show them well, now we can show them the hologram, which is amazing. But we show them these angles and numbers, and so they have something that we can measure objectively. So some type of, hey, this is 13.7 degrees that we measured your daughter's spine at. So just to show the reconstruction again of this particular patient, so you can clearly see this is what we have. And then later, let's work on this for a couple months and see what we can do. So, we can kind of show them the reconstruction model, or we'll call the Atlas model, which is kind of shows what the bones would look like all the way around, not just from the rear. And then we give them a handout. So the patient gets a handout of this, and then they have something again that they can, we can essentially send them home with it's an objective tool, something that they can relate to. I'll show you what one of those reports looks like too here. So
that's the patient education piece, is that you're giving them, much like a myovision scan or something like that people might be familiar with.
Like a posture scan or a myovision. Yeah,
I see.
Very similar. And then we can, show them, hey, these are the different angles, the different measurements that we have for you. So you can take these home and talk to your significant others about it. I think what's really seems to be beneficial is when I show people X-rays, and I've done that for years. It seems, I get a lot of, I'm not even sure what I'm looking at. Is that my back? Is that my neck? I just get a lot of that confusion. When we show them this, it's like, oh yeah, so right down here it's crooked. Oh, I can see that. Okay, yeah, I understand that. So it seems to be, it's not to say that X-ray isn't beneficial, but it seems to be that with this, it gives them another avenue, another way of showing the spine. And I think there's a lot of chiropractors even that don't have X-rays or don't use X-rays. Sometimes it's hard to translate what you're saying about the spine to something that they can see, right? It's so abstract, right? Saying, hey, you've got a subluxation in your L5 or whatever, and I'm going to work on it. It's like, what does that even mean?
Sure.
Yeah. So showing them something a little bit more concrete seems to help clear up that.
Is this used in the CBP communities a lot?
That's a great question. We haven't actually gone out and addressed Harrison and group out there, but it's definitely something that we'd like to do. We're just now getting started with our sales cycle, so yeah, we haven't really had a chance to meet up. But yeah, we'd be definitely interested in, if they're out there listening, we'd be definitely interested in talking to them about how our system could be a benefit within their.
Well, I know we got some big CBP practitioners that come on the broadcast from time to time, so I'm sure it can get back to them. But another question in the chat here that says, does one need to have a RadTech license to perform the scans?
So in 47 states, there is no regulation over who does the scan. So 3 of them, one of them is Oregon, I know. There's a couple other ones. I think it has to be the doctor that does them, or they have to have a special certificate in those states.
How about California?
California, no. So California, anybody can do it, which is great. So those that are thinking about getting a system, their staff can do it. And even better is you get reimbursement for that in California. So we have 2 codes. There's one code for we'll say the 2D ultrasound component with the read on it. Then the other component that you can bill for is the 3D reconstruction. So in order to make the measurements, you need the 3D reconstruction. And so that's another code that you're allowed to bill for. And so with personal injury cases, people can use them. You can use them with general insurance, and everybody always asks the price ranges. It just depends on which insurance you're billing. The lowest I've seen is United Healthcare seems to be the lowest reimbursement, around $100 for both of those codes together. And then it's up to 450 we've seen on MedPay. So in California.
So is it really just a matter of whether it's allowable by the insurance kind of thing, or Are
No,
they
it's
medical? Oh, go
it's a
ahead.
yeah, no, it's allowable. So it's a state of California, we're licensed to use any device that we need, any mechanical device to do diagnosis, right? So we're allowed access to just like an MRI or an ultrasound or whatever. And of course, the justification is obviously going to be looking for spinal alignment. So which is our system is cleared by the FDA to do that. So we basically we went to the FDA and showed them how our system compares to X-rays. And so we actually didn't tell them; we actually had to show them. We showed them our images and we showed them how they compare to X-rays. So we did that, by the way, for adults as well as kids. So we basically can use those for anybody. So.
Is there any particular contraindications that we need to be aware of?
Obviously, open wounds are a no go for those. You're not really going to get good images if they've had spinal surgery, especially hardware in there. It just unfortunately there's so much scar tissue that it turns it into a kind of a mess. We at some point we'll probably add data for those, but it's data dependent, and so what that means is we have to add more people with those conditions as part of our protocol for collecting data for our artificial intelligence algorithm. We intentionally left those out, the ones that already had surgery, just because they're so difficult to find, and we didn't want to confuse our AI. So we'll add those in later, but those are probably the two biggest ones.
And how about I'm sure this. I don't. Nobody's asked this. I know we talked about it, or it's a question I asked about. Liability in terms of if we are diagnosing, if we're using it as a diagnostic tool, what kind of liability do we have if there's tumors, fractures, things of that nature, all of that kind of stuff.
Yeah, we we're you're gonna be on the hook for looking for the alignment. So our system is not, the indications for use obviously are real general, but if you're looking at trying to find fractures and things on the spinal column, you're really not going to see those with a traditional ultrasound. So whatever you would see on a traditional 2D ultrasound, which isn't really much, when it comes to a spine. So you're only going to be on the hook for what you can see, right? It's like an X-ray. If you can't really see it, no one else is going to see it either. So, yeah, you're not really necessarily on the hook. What you are going to be on the hook for is making good diagnostic accuracy with your measurements. And so if you're telling someone they've got 35-degree scoliosis and they need a surgical referral, and your measurements really are not very good, and they should be 10 degrees, right? And they don't need a surgical referral, then so you're only going to be on the hook for accurate findings on your measurements. So
Excellent. Well, I know there's so much more. You're a Cairo kid like me. I know we talked about
yeah,
that. And there's so much more we could talk about. But this was super informative, man. If people tell us again one more time, if people want to get info on your system and set up a call with you for pricing and things like that, how do they do that?
yeah. So you can, well, two things. One is feel free to message me directly. So I reach out at Chris at Verdure Imaging, CHRIS at verdureimaging.com. Or you can also do info at verdureimaging.com, or our website www.verdureimaging.com. So again, it's VERDURE.
Awesome,
You
man.
can see it in my in my
Well, this was super informative, man. I really appreciate it. Thanks again, everybody, for your patience. I don't know why I had so
oh
many technical.
info at verdureimaging.com. Sorry, not at Verdure.
Okay.
So
We'll get that fixed up right there.
no worries. Thank you very much, Dr. Phil, for having me on. Sorry.
Oh, absolutely, man. Thank you for your patience again. I apologize about my technical difficulties. We're going to try to give away some money here. So hang out for just a minute and let's see. Tiffany's going to bring up the wheel. This is where pandemonium starts to ensue and the chat will start to fill up and that kind of thing. So if any other questions pop up in the chat, I'll let you know. But again, thank you so much. It's always fascinating to me. Do we got the wheel up yet, Tiffany? Okay, we're getting the wheel up. Yeah, there we go. It's always fascinating to me to just see the developments in the chiropractic profession, since we were kids, and just our ability now to, stand up for chiropractic. And that's what I love about people like you doing what you're doing. And that's what we're trying to do here at the Chiropractic Association. And it's no longer an issue of if chiropractic works, kind of thing. So, all right, well, let's do our first name. I believe we have 5 names this week. Dr. Peter Kevorkian is our first name. Dr. Peter Kevorkian is the new president of Life West Chiropractic College West. I don't know, maybe TJ can text Dr. Kevorkian real quick, tell him he just won $500, but he's got to get here to claim his prize within 15 seconds. Dr. Peter Kevorkian, I just talked to him too about he's going to do some sponsoring for us at our Seaside Symposium coming up in March. Maybe that's something we could talk about more too. We got a big event coming up in March 20th in Seaside. It's going to be some great content. Dr. TJ and I were supposed to have a meeting today at 12:30 about a potential presenter. So I'll have to get after him about that here when we're done trying to give away some money. So I don't see Dr. Kevorkian in the chat for today. I'll text him and tell him his name got picked. So let's do name number 2. Oh my gosh. Dr. Khalsa. We'll just go with Dr. Singh Khalsa here. I am not going to try to pronounce that name, unfortunately. Dr. Khalsa, you are the winner, the second winner that we have. Let's see if you're here to collect your prize. But yeah, like I said, have you heard much about our event in Seaside yet, Chris?
I have not, but you told me a little bit about last time. But yeah, please fill me in.
Yeah, we got quite a few things going on. I didn't get a chance to make the regular announcements this week, but Seaside Symposium's in March. We have the women's event in January coming up, and we're all set for our fall conference in La Jolla. That will be in November, I believe. So, all right, let's do name number 3. I don't see Dr. Khalsa here. Name number 3. Mark Rubens, you are name number 3. Mark Rubens. I don't know, Mark. I knew Dr. Rubens once upon a time. There's some information about the Seaside Symposium. Tell us a little bit about, are you in California, Chris, or are you in different part of the country?
Yeah, California, Stockton.
Oh, excellent. That's right. Excellent. So I guess if anybody really wanted to see kind of how it works in a practical setting, they could come and talk with you, huh?
Yes. And by the way, we're about to get it, installed at Life West as well. So anybody in that area.
Awesome.
We can keep you. It's been there on and off, but the official clear system will be there. Yeah, so anybody. So I don't think Dr. Kevorkian knows about that, but.
All right. Well, I won't tell him. I won't say anything until you let me know. All right. Let's do that. I don't see Dr. Rubens here or Mark Rubens here. Let's do name number 4. Nicholas Pedroza, your name number 4. I'm actually an adjunct professor at Life West. So who are you working with there?
Dr. Donaldson is the one that we're having to push through right there. So he's the one that's kind of heading that clinic, the outpatient clinic.
Yeah.
And Dale Johnson, so Dr. Johnson.
Oh.
Monica Smith, probably you know as well.
Yeah.
Yep.
I love all that. Yep. I never had Dr. Smith, but both Dr. Johnson and Dr. Donaldson were instructors of mine, or Dr. Donaldson ran the clinic when I was there and that kind of thing. And
wow.
We are you working with Dr. Motley at all?
Yeah, Jamie. Yeah, so she's been great. So yeah, Jamie. Jamie actually gave us a nice letter recommendation for some grants or what that we were producing. So she likes our system. Of course, that's the board certified radiologist there, and I think she heads the program still, I believe.
Yeah, for sure. All right, I don't see Nicholas Pedroza here today, so let's do name number 5. Lynn Spillinger. Let's see if Lynn Spillinger here. We're actually talking with Dr. Motley right now about being one of our keynote speakers at the Seaside Symposium. So maybe we can do some collaboration where she can talk a little bit more about your system and your technology too.
That would be spectacular. So I would. Yep. I would love
It
to see
sounds
that.
like everybody in the chat here is like, oh, I second the idea of seeing him do demos at Seaside and that kind of thing. And I know when I was at ChiroFest and saw kind of what was possible, I was like, okay, man, this is some cutting edge stuff. So it's pretty cool to see what you've created. Amazing. Like I said, I love seeing fellow chiropractic kids continue the development of chiropractic, because um, that was BJ's theme, right? As he was going to develop chiropractic, even though, in spite of his dad, kind of thing. So, all right, everybody. Well, thanks so much for being with us today. Super informative. I feel like our relationship is just starting and unfolding. So, hopefully, people will get a chance to scan your QR. I already see people scanning your QR code, so
Sweet.
that's good. And look forward to working with you more in the future, man.
Absolutely. Well, thank you very much again for having me, and I appreciate it. Yeah, glad to keep the profession going in a positive direction. So.